Hi everybody, welcome back to another Therapy Thursday. I'm here with Dr. Peter. Today we're going to be focusing on everything having to do with the elbows when it comes to tendonitis and all associated issues. So I'd like to let Dr. Peter take the floor.
Yes, when we talk about elbow tendonitis, first things first, often it's not inflamed. It really is not a tendonitis, it may be what we call a tendinosis, some damage to the tendons, typically from overuse, and typically when the flexors of the elbow, which come from the inside, are not as equally strong as the extensors that are attaching on the outside of the elbow. So this balance between those can definitely cause you problems. Any kind of overuse can cause you problems. Racket sports, as we call it, tennis elbow for the outside, golfer's elbow for the inside. So racket sports are commonly at fault. People that lift weights get problems quite a bit as well. Well, the flexors of the elbow attach right here, as you can see, and there's a lot of muscles all attaching to a very small piece of bone really right there. So any kind of overuse of your flexors that you use when you grip, when you squeeze too hard in your weights or just holding on to the weights can cause a repeated pulling on that bone on the inside of your elbow and can get either the bone irritated or the tendons irritated. And you can see how short the tendons are, so the muscles almost directly attached to the bone, so it's a lot of pull on the outside of the bone. It can get quite irritable. So it's where the flexors of the elbow are causing, more problems with the medial epicondylitis or any kind of medial epicondyle pain.
So if I'm experiencing pain in this area, I guess it would be safe to say as I need to focus on what am I doing that's causing flexion or constant
problems right through there.
Wrist.
Yes.
Now, if I can, number one, isolate, well, what is I'm doing that's causing that? Maybe I can reduce the amount that I'm doing that or give it a break. If I find that the way I grab my, purse or my bag or my suitcase, whatever it may be, every time I pick it up, I notice that that's causing that flexion. I can become more aware of it, but what do you recommend that somebody having that kind of pain would start to do initially to see if they can get it to kind of come down on their own?
Yep. One of the things we can do is when we supinate the elbow, so when the palm is up and grip things like that, we engage the flexors a lot more.
Okay, so that would be like a supine row?
Supine row, anything, biceps curl where the hand is supinated. Okay. So if you go to a neutral position, where the palm is not up and not down, you will alleviate some tension right through there.
All right, so applying, if you're doing barbell curls and that's causing you pain, you can maybe go neutral to continue to get some curls in.
Yes, or even go to a pronated position where we now move more onto the lateral elbow, take some of the tension off the flexors right through there. So you don't have to stop using it, you just have to kind of modify using it.
Okay.
So that's a good way to do it and see if that makes a difference. Okay. If it does, we now know that we can resolve it pretty quickly. The issue with this is people just kind of keep pushing it, or they stop for a little while, the pain is gone, they think they're resolved, and now really, just because your pain is gone doesn't mean your symptoms are completely resolved. You're about 80%, so now you start curling again and you flare it up, and that's how things get real chronic.
Well, I'd love to show a couple mobility techniques that, maybe like some barbell smashing or some, flexion extension exercise, maybe using bands. What do you recommend that we could play with on that?
Yeah, absolutely. We can show some exercises, and I think let's do that here.
I know that we've talked about when it came to position of the knee over the toe, what proper range of motion was, and we had set up on the column. And do you have a similar measurement stick for the wrist?
Not really. You want to get at least the elbow straight and the wrist to about a 90-degree movement.
Okay,
right?
so if I were to get on the ground, to be able to say that my palm can be flat on the ground, my shoulder can be, at least somewhat into a 90 position above my wrist.
Yes.
Maybe find the knuckle region would be good.
And yes, and anything you can lean over that. And then what you want to do from there is put your wrist in a couple different positions, pointing the hand a little bit more in, pointing the hand a little bit more out, and see if there's a particular position that really gets to your pain, because then that's the muscle you're trying to stretch. Yet you can't get to that position, it's a soft tissue problem, likely in the flexors, but the flexors attend to your biceps, attend to your pecs. Okay. So any tension in that medial line can cause you to have that restriction.
So what would be my first step in fixing that?
First step would be just repeat it, go as far as you can, hold it for a second or two, and go back. And just basically bounce into that a few times and see if some repeated movement will allow you to get some more flexibility through that. If that's
I can
painful,
already feel my right
yeah.
wrist letting go.
So-
My right wrist is always my problem.
Yep, and that can easily set you up. A restriction in your wrist will have to be compensated somewhere. Your elbow is the first likely, joint to have to compensate for that.
Okay.
So repeated movements definitely are a good place to get started from that.
Okay. As I develop from there, what would be next steps?
Well, next step from there is I would do eccentrics. Eccentrics, negative loading on the wrist flexors and wrist extensors will really help the mobility of those tissues. Even better than
Like the old
stretching.
school winding things?
Winding things, yes, or just with a barbell. Let's say if you're working your wrist flexors, curl it up and then real slow lower that down with a little bit of resistance. Do as much as a range as possible.
I like it.
Eccentrics are great for gaining mobility.
Okay.
And you get strength at the same time. So, yep, kettlebell right here, we do it just over the edge of the box. And so what I would do, you can start hanging here first if you can do that. Use your left hand actually to bring it up into a flexed position.
What do you mean?
Well, just bring it up all the way. No, just your wrist. Just the wrist. There you go. So give the concentric part a little bit of support. Let go of your right hand, and now slowly lower that down, lower that down, lower that down. Completely extend your wrist. There you go. Let the kettlebell pull you down.
Do you want to put the palm or keep it right there?
No, just keep it right there. Bring it back up with help if needed. Hold it there for a second. Get a nice isometric contraction. Another thing you can do really for pain is isometrics. Okay. And then slowly go into eccentrics where we load the arm while the tissue is being lengthened.
Now, this is all on the flexors.
Yep.
What about extensors?
Well, extensors, similar problem, just the opposite direction, right? And so extensors tend to be weaker than the flexors, just because so much of what we do is with the flexors and gripping. And so oftentimes wrist extensor weakness in relation to your flexors may be causing some tendonitis on the outside of the elbow.
So
same principles, we would stretch it just like this. Right, and so, but now in order to get it stretched, you need to flex your wrist.
That's what I was going to ask. So going back to this situation here, we've got tightness through my extensors here.
Yep.
Now, if I want to go into wrist flexion, obviously you've seen I've got a limitation here. Now, if I go to my right or my left wrist, see the difference here. This is where my major issues are. Now, extension, not as bad, but definitely through flexion. Now, look at what happens in my whole shoulder line.
Yes.
This is a perfect example of what can happen to people when they've had injuries, of limitations. This happened when I was 18 years old. Yep. So literally 18 years ago. And look at that, I still have this limitation, and it plays into a lot of different things that I do. Now, looking at this, I experience tension through this extensor line, and I know a lot of people have pain here. I hear people complaining about this all the time. If I try to flex like this, and you see what's happening here is I can't even get down. Now, this wrist is great, so we'll talk about that in a minute, but what if somebody's having a problem getting into this position? What do you recommend as being the best position to start with and how to progress?
Yes. Now, first things first, you've had this for 18 years. I'm not expecting a great deal of mobility improvement anymore at this point. So if you can stretch it in that position without pain, it's okay to stretch like that. Otherwise, we'll have to do it with the weight off. And then again, try with different rotations where you can reproduce your tightness that you feel right through there.
What else can I do to help this part of my arm, all these tissues relax?
Same thing. So we've done some stretching. Eccentrics is then your next best bet. Okay. So we're going to go to eccentrics and we use the kettlebell again. Okay. Bring it up into full extension. Okay. So bring it up, support it with your left hand if needed.
So that's as far as I can extend on
that's okay.
Right wrist.
You go through whatever range you have.
Okay.
And now slowly let that wrist flex. But we're going to take 3-4 seconds to just get as much wrist flexion with control. It's all about control. So slowly these muscles are lengthening while they're still contracting. Bring it back up.
I'm going to start practicing.
Eccentrics really work well in gaining strength as well as mobility. And if you got any kind of tendinopathy or tendonitis, this is the first thing you can do to calm that down. If this is too painful, just start with isometrics. Just bring it up and hold it in some extension and just hold it there for a few seconds. And don't worry about the eccentrics yet until you can do isometrics without pain.
I'm following you. There's always an up chain, down chain reciprocal effect. So if we're talking about wrists, we're talking about elbows, we're talking about shoulders, we're going to be talking about necks. So today we were able to cover the elbow. We talked a little bit about wrist position, the elbow position, what's going on with the elbows. Next week, we'll talk more about the shoulder and how up chain from the wrist through the elbow into the shoulder, and down chain, we can have issues and how they correlate.
Yeah.
So I appreciate your time today.
Thank you.
Yeah, to the next one.